Hi, my name is Tiffany Warner, and I'm going to be presenting the article about managing cardiovascular risk with Tai Chi in people with coronary artery disease. So, the research question is the aim of the study was to implement Tai Chi exercise, nutrition education, and stress management as a cardiovascular risk management program to assess the effects on cardiovascular risks, health behaviors, and quality of life in individuals with coronary artery disease. The problem is the number of global coronary artery disease deaths is expected to rise over the next 2 decades, which could be preventable if effective interventions are applied to reduce the factors. So some patients may not participate in the interventions due to the lack of motivation, high cost, and limited accessibility. The significance to nursing practice is that Tai Chi exercise in low to moderate intensity has been suggested as an ideal exercise for patients with heart disease. This study reported in this paper was designed to apply Tai Chi and nutrition education as an alternative nursing intervention to a cardiovascular risk management program to assess the changes in cardiac health behaviors, modifiable risk factors, and health-related quality of life in patients with coronary artery disease. So Tai Chi is safe, low cost, low tech, highly accessible exercise alternative, and it also improves behaviors and quality of life for patients. So no map, model, or theory was specifically identified, but there was a flowchart that was provided. It is a quasi-experimental pre-test and post-test design with a non-equivalent control group that was used. The independent variables are Tai Chi exercise, nutrition education, and stress management classes. Dependent variables are cardiovascular cardiovascular risks, health behaviors, and quality of life. The research variables are age, gender, education level, admission history, economic status, relative health status, chronic diseases that could have been present. So the intervention in the study was that Tai Chi with education that included nutrition education and stress management classes. The Tai Chi only group, randomization was not possible, and group assignment was made according to participants' preferences. A convenient sample of 117 adults with coronary artery disease was recruited by recommendation by their primary physicians. These patients who attended outpatient clinics for coronary artery disease and they were eligible for long-term exercise. These patients then made the decision to join, and their age and medical conditions were then considered, which ensured similar distribution throughout these groups. Group assignment was then made according to the participants' preferences. These patients' mean age was between 66 years old and ranged from 53 years to 75 years old. Group distributions for all characteristics except gender were similar. Tai Chi with education contained more males than in the Tai Chi only group and control groups, and more than 90% reported having conditions other than coronary artery disease. 33 people were in the Tai Chi with education group, 19 people were in Tai Chi only group, and 33 people were in the control group. So the dropout rate was between 27%, so 85 people were involved, and the potential attrition rate was estimated to be 25-30%. So the inclusion criteria was that no cardiac surgery was supposed to be planned during the following 6 months, and patients had to be literate in order to understand the questionnaires and educational classes. The exclusion criteria was that previous history of any form of a formal exercise program and nutrition education. Ethical components for this study were not stated, but it did state that the study was approved by the appropriate ethics committee. Informed consent was also not obtained. So data collection, the Tai Chi was delivered once a week for 60 minutes with a requirement of at least 3 times a week at home. Nutrition education classes lasted an hour on the first week of each month. The stress management classes were held for 1 hour the third week of each month by humor experts, and attendance at each class was recorded. So it was collected between September 2005 and March 2006 on cardiovascular risk factors, health behaviors, and quality of life. Scores for cardiovascular risk factors were calculated based on a cardiac risk factor profile and the sum of weight, scores for age, family history, cholesterol, glucose, SBP, obesity, smoking habits, stress, and exercise behavior. Data was coded and analyzed on a computer only accessible to the research team by a password, analyzed using SPSS for Windows version 15.0 software. Analysis of variance and chi-score tests were used to compare the general characteristics and outcome variables between 3 groups at baseline. Groups were compared at post-test with analysis of covariance, pre-test scores as a covariate for health behaviors and quality of life, pre-test scores and BMI as covariates for cardiovascular risk factors were used to adjust any differences at baseline. The Chef's test were used for post-HOC comparisons only when statistically significant group differences were present. So the limitations of the study were group assignment and randomization was not used. Losing participants led to an unequal gender distribution at post-test measurements. Classes were performed on Saturdays, which were disadvantageous to women because they were expected to be home by their family members. Male participants seemed to enjoy the routine. Most dropouts from Tai Chi with education were women, and most dropouts from the control groups were men. Dropouts from both groups were due to not being able to miss work and hospitalization. Motivation was an issue because participants had the choice of which class to attend. So higher motivation means that they participated in groups and the higher performance of health behaviors. Differences in chronic diseases like arthritis may affect the participants' exercise and health behaviors and physical function and quality of life. So the implications to practice: the Tai Chi is safe for cardiovascular risk management programs. Combining Tai Chi with education improves modifiable risk factors, exercise and diet behaviors, and mental and emotional dimensions of quality of life. Tai Chi is low cost, low tech, highly accessible alternative and can be practiced in clinical or community settings. The implications to nursing: so the nursing intervention should include Tai Chi in combo with nutrition education and stress management. Gender differences should be recognized when developing cardiovascular programs as well. So in conclusion, Tai Chi with education is more effective as it generates positive change in participants. Outcomes in cardiovascular risk factors, cardiac health behaviors, and mental and emotional components of quality of life are more favorable, and modifiable risk factors statistically significantly lower. Participants who complete Tai Chi with education perform exercise behaviors like walking and diet behaviors more frequently. Tai Chi can be safely implemented in a cardiovascular risk management program for individuals with coronary artery disease. Thank you for watching.